A new COVID booster shot. It's rolling out across the country, aimed at stopping the contagious Omicron variant.
Get your updated COVID-19 shot as soon as you are eligible.
But where and when can you snag yours? We called around to local pharmacies to get you answers.
Plus, health officials approved the new shot based on final testing data from mice, not humans. Find out why the FDA says the booster is still safe and effective.
I will be at the front of the line at the pharmacy getting my vaccination. I'm very confident about this.
Let's dig into it. Before the COVID vaccine first came out, it was tested on tens of thousands of people, all to make sure that it was safe and effective.
But with the new booster shot to target that contagious Omicron variant, there's a whole lot of talk online saying it was just tested on a handful of mice, not people. Is that true? Let's verify. A tweet from Dr. Urso with the Pandemic Health Alliance has more than 24,000 likes and more than 11,000 retweets, saying the booster was tested on, drum roll, 8 mice. That's it. Our sources for this verify are the CDC, FDA, and CBS News medical contributor Dr. David Agus. According to documents on the CDC website, human tests of Moderna's version of the new booster are still ongoing. Right now, there is only final evidence from a group of 8 to 10 mice. The FDA's website shows for Pfizer, they also relied on the final study evidence from 8 mice. But human trials are also still ongoing. So far, the new booster showed a similar local reaction and systematic event profile. That means side effects appear to be about the same, including mild to moderate injection site pain, fatigue, and muscle pain. So it's true, right now, final testing has only been done on mice. Okay, are you thinking right now that these people are crazy and out of their minds? I had those similar thoughts when I first started researching this. But then I learned that there's some important context about why health officials say mice are more than enough to approve the shots. On a podcast with Johns Hopkins School of Public Health, the FDA commissioner explained why they're moving forward without the complete human trial data.
In the midst of a pandemic, if you wait for all that data to come in, you've missed the boat. And so you have to be preemptive.
He also said the decision is based on
Totality of evidence
from previous COVID vaccine trials. The commissioner told CBS News the bottom line is the vaccine boosters are safe and effective.
I will be at the front of the line at the pharmacy getting my vaccination. I'm very confident about this.
This COVID booster approval process is similar to how the flu shot is updated every year, according to CBS News medical contributor Dr. David Agus.
While we have little safety data, just like the flu shot comes out every year, and it really is tested as we give it, we're going to do the same here. So we think it's close enough to the original COVID-19 vaccine. It's the same outer shell, slightly different spike protein, that it is going to be safe.
I also reached out to Moderna and Pfizer for comment today. I'll let you know when Moderna gets back to me, but Pfizer sent a statement saying the FDA decision to go with preclinical or non-final data in humans was okay because they wrote in part, "We are facing a virus with an exceptionally high mutation rate. Moving forward, this approach may help address the pressing need for vaccines that provide a high level of protection against current and emerging variants of concern." If you want to know more, you can read the rest of their statement on our website, WFMYnews2.com.
Of course, there are 3 questions about the new boosters that you've been asking online, right? Who should get it? Where can you get it? And when should you get it? Let's start with this one right here. The WHO. Moderna's booster is for Americans 18 and older. Pfizer's is for those 12 and older. People could get either booster just 2 months after receiving their last shot of the COVID vaccine. Anyone who is immune compromised should go ahead and get that booster. Doctors even saying this.
Well, my grandma's living with me, or I'm going to go visit my parents who are in the nursing home, or I have someone who's immunocompromised at home, or I work in a place where there are vulnerable people. So I'm going to get the vaccine so that I don't transmit it to other people.
To answer the where you can get the new booster question, well, I spent a lot of time dancing to hold music this morning, badly dancing at that, calling around to local pharmacies. Most say they should have the new COVID booster in stock by the end of the week. But when really is the best time to get the booster? You want it to have the most protection when cases are spiking. The FDA says go ahead and get that booster as soon as possible.
We are looking at a possible fall wave with a peak around December 1st. And by giving the booster now, we will hopefully both control the current plateau that we're in, even though we're dropping off very slowly, as well as address this future potential wave that looms out there.
You know, a lot of people fell behind on vaccinations during the pandemic. It wasn't that they just decided not to get the COVID shot. It was all vaccines, each vaccine with the chance to save a life and keep you from disease. We took a closer look at why doctors say it is important to get back on schedule. There's the usual check: blood pressure, heart, lungs, all of this at Phyllis Taubin's annual physical.
Breathe deep now, in and out.
But today, she's also due for a dose of the pneumonia vaccine.
I think it's very important to have them. It's vital for your overall health.
The vaccine is recommended for adults age 65 and up. It protects against several types of pneumococcal bacteria.
Pneumococcal pneumonia is the #1 cause of bacterial pneumonia. The older you get, the riskier it is. It can spread to the bloodstream, and it can be a devastating disease, so we do want to prevent it.
Other immunizations for adults include Tdap to protect against tetanus, diphtheria and pertussis, HPV to prevent cervical and other cancers, hepatitis A and B, and herpes zoster to help prevent shingles.
And then we'll keep going.
Dr. Karen Behar is medical director of NYU's Lagone Joan Tisch Center for Women's Health.
See your doctor once a year. Have a conversation about things that are routine: vaccines, blood, mammograms, colonoscopy. You should bring it up to your doctor. What vaccines am I due for? And at different ages, you're due for different vaccines.
Phyllis received her shingles vaccine last year.
To ward off actually getting shingles, because it's, I know, very painful.
And she gets a flu shot every year. So that's the next vaccine on her list to help stay safe and healthy this winter. Now, about that flu shot, doctors say you might want to get it earlier than normal this year because flu season is already starting to ramp up.
Yuck. And today, the White House also said it's time to start looking at COVID shots like flu shots. I mean, you're probably going to need a new one of those every year, too. As they roll out, we'll be here to dig into it.